Hello everyone, my name is Natalie and I'll be presenting a case on one of my patients who had pituitary adenoma. So I have a 50-year-old female of Mexican ethnicity who came in for mastitis. Um, so a little bit about her background. She was diagnosed in 2006 with a pituitary adenoma, which is a common benign tumor in the sellar region, which arises from the anterior pituitary gland. So with this, it has caused her to have some symptoms of pregnancy. So she does get the morning nausea, vomiting, the bloating. She says she gets the cravings. And then, worst of all, she does have a milky discharge from her nipples, so galactorrhea. And she does feel engorgement. And so that's actually what led to her mastitis. So she is married. She receives social support from her family in the form of emotional and instrumental behaviors. During her treatment, during her hospitalization, we were treating her with antibiotics, and fluids. And she was very receptive to that, and she was her swelling and her redness went down significantly. She only stayed in the hospital for I think max of 3 days. Her nursing diagnosis was infection from the mastitis, her knowledge deficit, and non-compliance. Interventions for her to provide and enforce the significance of care interventions. So a little bit of a background about my patient. She has had quite a complicated sort of past. But currently she is the founder of a for-profit organization that offers low-cost classes for boxing for the youth and for the public as well. She started this idea for her organization when her son was arrested. So she had lived a life in a gang and she realized that she did not want that for her son. So she turned her life around, gave her life to Christ. She started this gym to kind of give back to society in a way to keep kids off streets and out of gangs, allow them a healthy outlet for anger, as well as provide exercise to build a healthier lifestyle. In doing this, my patient runs the entire organization. She takes a lot of the responsibility onto herself. So if there's no one to clean, she cleans the entire gym. She cleans toilets. She helps clean the equipment. She provides the resources for the gym to stay going. She provides rides to kids who don't have rides to competitions. And so she does have help, but she chooses to just put all of that on herself. So it doesn't really leave her a lot of time to take care of herself. She has said that she doesn't prioritize her own health when she's always thinking about the kids and this organization, what it means to her. She's very self-sacrificial, and that's very honorable in a way, but I tried to enforce how she will need to take care of herself more in order for her to take care of her gym. So with the side effects that she was having, they've been helping her to manage it. So she was on Pergolide, which is a medication for prolactin secreting adenomas, but she said she didn't like how it made her feel. She said she felt crazy on it, and she felt like it wasn't even helping her. Miraculously, though, her tumor shrank. She did not need any invasive surgery. They were planning it. However, because it had shrank significantly, they no longer had to do anything invasive or any use of radiation. She's not very she doesn't like the idea of having radiation, taking medication. She is very into just praying about things. So, in concerns to her self-care capacity with chronic illness and treatment demands, this patient is fully independent of her ADL. She drives. She's completely mobile. Has no, does not use any walking devices. Doesn't need anything from home health of any sort. She does need education, however, to manage symptoms, her symptoms that she does have from her benign tumor in the pituitary gland. She does not take any of her medications, which because she says she feels better when she doesn't. So she is rather non-compliant, and this could be an issue for discharge planning because she does forget her doctor's appointments. They'll be scheduled for her, but she will not write them down. She will not have them anywhere in a calendar. And she just doesn't prioritize them because she does, like I said, she has a very busy life. She puts everyone else in her life ahead of her instead of her health. So she believes greatly in the power of prayer to help her manage her health alone. And that is something I had to respect because that is her beliefs, but I did have to still remind her that she is still human and she needs to also remember to care for her body because God only gave her one. Also, she takes care of the gym in its entirety. So I asked her, is there anybody who could help oversee things when she is not there, kind of like a partner? Someone she trusts, and she does say that she does have people who she trusts, and they would be very willing to help her out. And I said she needs to start delegating responsibilities to them because without her health intact, she won't be able to run her gym while being in the hospital very often. And she kind of paused for a minute to kind of take that in as in a certain point of view. So the discharge plan for her is just to go home and to follow up with her primary care provider. So she was sent home with antibiotics, oral antibiotics that she is to take, and she needs to follow up with her primary care provider just to make sure that her infection and her inflammation in her breast has not returned or has worsened. Okay, so so she does need some education in self-management in her diet. And self-management is a dynamic process in which individuals actively manage chronic illness. So in doing self-management for herself, she does need to manage her diet a little better. She is always so busy. She's always on the go. She does eat a lot of fast food, which does have a lot of sodium, which could also be contributing to her bloating sensations. She does need to go to her regular checkups because though this tumor is benign, you never know if it can grow, if it could obstruct, and she needs to follow up and have it checked out about every 6 months or so. Okay, so interventions for her is to provide education on managing side effects or symptoms of the pituitary adenoma. Nausea, mastitis, and bloating. For nausea, I had recommended that she eat small amounts at a time and limit her fluids or any sort of drinks during meals to prevent that feeling of fullness that can cause her to want to not eat as much. So just to help with her appetite. For management of her breast pain or mastitis, she needs to wear a supportive bra. She could invest in a pumping machine to help. She needs to help release the fluids, and also moist heat compress. But I know that sometimes pumping machines can be out of people's prices ranges, or she didn't seem too thrilled about a pumping machine. So I did tell her, I'm like, well, you could always express the milk, but you do need to wash your hands before and after, because this will help prevent infection, such as mastitis as well, or just infection in general. So I was talking to her for quite a long time, and I know that she takes on a lot of responsibilities, and not only that, she may be married, but she runs her household, and she does deal with a lot of stress in her life, and she says that she can manage it with the strength of God, which I applaud her for that, to having such faith. But she still has some emotional things going on, especially with her son, and that weigh heavily, on her mind, especially having a chronic illness. It can be very taxing as time goes on. So I offered her, I recommended her maybe to go to group therapy, group support, or psychotherapy, just talking to a therapist. Or during her hospitalization, I asked if she wanted someone to come pray with her during this time and through what she's going through. And she loved the idea of that, so she said, yes, please. So, and by doing this kind of helps, it's like for cultural considerations, it helps build trust between the nurse and the patient. And also I recommended that if she feels that she's a little hesitant about psychotherapy, there are Christian therapists out there as well, if she would prefer that. In utilization review, we reviewed the medication records to provide a little bit of a background on what she's taking or what she's not taking, and why she could be admitted. Collaboration transition, this is just to help place her on what kind of status that we need to place her on, either observation or inpatient status. Originally, she was on observation status, and then we decided to keep her as inpatient. We were very careful that we have to be careful that our patients do not overstay their visits, because they can get a hospital-acquired infections, and patients should really only stay until they necessarily have to, until treatment is provided and they're able to recuperate at home. Also, the costs of hospital stays are becoming more costly each time, each test, each time they take blood for lab work daily, and there's also just different hospitals and insurance fees, so we want to keep that in mind for patients, especially those who have low incomes. So for quality and safety, we want to promote safety and risk education. So as throughout her hospitalization stay, I just wanted to keep in mind that she will probably go home with an oral antibiotic, and she will need to know how to take them, and she does need to take it. So I repeated myself over and over so that it made some sort of an emphasis to her. Also she is given written education, but also to take that written education and read it out loud to them, go over it with them, because I noticed some patients, you will hand them a packet of papers and they'll say thank you and just put them away in a drawer. Towards the end, on discharge, it would be best if we could arrange the follow-up appointments for them so that they'll know it's scheduled and they don't have to worry about it when they get home, because some patients do forget to schedule a follow-up appointment after discharge. It slips their mind. It's very easy to do. So this way they will receive a reminder card as well when they're discharged, and that way we can kind of help them keep on the continuity of care. So I believe in repetition of information that helps with helping that information stick better. So I emphasize that she needs to follow up on her checkups more often, that we need to keep monitoring the tumor, though it is benign, all the risks that could happen if it were to grow, if it obstructs, or if she's not managing her symptoms properly and not getting enough, care for herself. She's not taking the time to self-monitor. So we also want to make sure that she adheres to the antibiotic. She understands that she needs to take all of it and not just stop when she feels better. And that she also understands its purpose, the reason for taking it. I'd also provide her resources for psychotherapy and support groups for emotional support. So I left like Livy Counseling is a Christian therapy group which provides individual and group therapy. And then though she doesn't have cancer, though it's classified, they do have like support groups for that if she wants something more of a more public. Okay, so going over the effectiveness at patient level, I would talk about how would she start prioritizing her her goals to keep her doctor's appointments. She says, well, I could always get a planner. I'm like, that's great. They're not very expensive. You can even make them yourself, but also because everyone has a phone nowadays, to also put alarms the day before to remind her of her doctor's appointment so that she doesn't happen to plan something the day of when she has to go. So I told her she can also invest in supportive bra and pumping system. If not, expressing the milky discharge is also fine too, but just to also wash her hands. And also for supportive bras, they don't have to be super expensive. There are many at Walmart. Also to prepare her lunches before she goes to work or anywhere that she has obligations, with lower sodium the night before. That way when she leaves in the morning, she can just get it and go. She will need her to verbalize the purpose of the medication, that the antibiotic that she's taking home with her, and that she knows the risks of not taking the full amount of antibiotic. So, and made sure that she understood that she needs to start taking care of herself, and making sure that she has someone within her organization who she trusts to help run it, so that her health is intact, and as well as she can help run her gym and help see that flourish and help her have a better quality of life. Thank you.